I am joined now by the Deputy Director here at Roswell Park, Dr. Renier Brentjens. It's a real pleasure to have you join us here tonight. We've already shared a couple of the stories, and there are many more of people who have seen so much success with the clinical trials that you're doing here. What a year it's been for you.
It's been a phenomenal year, and just remember, I mean, it's those clinical trials. That's what brings out the dedication of the folks that work at such a great institution like Roswell Park, where really the goals are to utilize those clinical trials to give our patients hope, to provide the best care for our patients, and ultimately to come up with better treatments, not just for our patients here in Buffalo and Western New York, but in the world. And that's why it's so great to be associated and to be working here at Roswell Park.
We hear these words, immunotherapy, CAR T-cell therapies. There are a few others that I'm missing, but it has to do with tapping into your own body's defenses, right? How it seems like you're really on the forefront here of something that's turning out to be pretty special.
Exactly. So it's possible to, over the years, certainly in the last 10, 15 years, we've identified the ability to take your own immune cells that fight infections, and we can take them to the laboratory and we can reteach them to recognize cancer cells, and then we put them back in the body, and it actually works. Now, we're kind of at the start of this therapy. When we talk about, we call them CAR T cells, and it's an acronym. But the analogy I always use is that we kind of have a Model T Ford, and really what we need is a Ford Mustang. And so the ceiling is tremendously high on this technology, and it gives so much hope that we're going to move away from these chemotherapies that can have so many side effects and focus on more targeted therapy. And again, that's one of the great things about Roswell Park, is it's dedicated to developing that technology for our patients, for the people of Western New York. Yeah. And obviously broader than that.
I think that's what's so significant here is this isn't groundbreaking research that's happening somewhere else. No. It's not happening in every community, and how fortunate we are that it's happening here.
Yeah, I mean, it's actually, you're being very kind about it. It's not happening in every community. It's not happening in many major universities either. And we've been able to call together a group of experts, both in the laboratory and in the clinical setting, that we can do this here, and it's actually quite unique. And our expectation is in the coming years that there are going to be people not just from our own community, but from the broader state and country that are going to come here because of how good the program is that we've developed here, and how Roswell's dedicated to what's going to be the next generation of cancer care.
I've only got about 30 seconds left, but this is your first Tree of Hope with a crowd here as Deputy Director. It's a pretty special event.
I'm always blown away, and I grew up in Buffalo, and I know what Roswell means to the community, but it's such a phenomenal, it's so phenomenal to be part of something that is as special as this institution, the people. And this doesn't surprise me at all. I mean, only in Buffalo can this many people come out when it's so freaking cold.
Yeah, absolutely. Dr. Brentjens, pleasure to talk to you. Thanks so much.
Thank you so
much. We really
much.
appreciate it.